So hi everyone, and thank you for joining me, and thank you Traditional Medicine for inviting me again. So my topic today is Nature's Pharmacy and Lymphedema, which are case studies on how essential oils can help. This topic is very personal to me because I have been treating lymphedema for many, many years. Sometimes we don't understand why somebody is getting these conditions. It just occurs very suddenly. As you can see from my background, I have quite a lot of experience in different fields as an alternative therapist. I have studied all these modalities to help me with my clients, and I have been in practice for the last 27 years as a clinical aromatherapist, and I studied all these other modalities, which I'm not going to really go into. So let's discuss what is lymphedema. I'm sure all of you know lymphedema. You may have seen it as well, treated it as well with different modalities. So obviously it's a condition characterized by swelling in certain parts of our body, especially the arms and the legs. So if somebody's had their breast removed from a breast surgery because of cancer or lymph nodes, their arms are going to swell up, and the legs happen also due to many, many conditions, which we're going to discuss today. So this obviously occurs due to accumulation of lymph fluid, which is obviously blocked in certain areas. This also occurs when the body's lymph vascular system is unable to fulfill its job by reabsorption and transport of protein and lymph load. This transpires when our lymphatic system is damaged or impaired due to either mostly from surgeries, radiation therapy, or congenital issues. Fungal infections can be also quite frequent, and this places a higher load on the system. In severe cases, thickening of the skin will occur, and I've seen this as well, which is fibrosis, which is a hardening of the lymph, and the leakage of lymph, and massive swelling, which is elephantitis. Now, there are various forms of lymphedema. There's primary lymphedema, which happens due to development and abnormalities. This is normally from birth, it's genetic mutation or advanced later in life with no apparent reason or trigger. Congenital lymphedema is normally present at birth, mainly due to genetic elements again, which then affects the lymphatic system. Then we have lymphedema praecox. This normally takes place during puberty and early adulthood. Affects mostly young girls and women, and the leg increases at a constant rate once manifested. This is also not a very nice sight to see. Then we have lymphedema tarda, and this comes after the age of 35 and above. This occurs in the interstitial spaces of the skin, and healing is notably impaired as well. So what are the various forms of lymphedema? We have secondary lymphedema, and this occurs due to damage to the lymphatic system, such as, again, as I mentioned, surgery, radiation treatment, or trauma as well through accidents. Feelings of numbness and tingling or a fullness in the limb can be felt. Surgical or traumatic lymphedema. This is caused by damage to the lymph nodes during surgery or an injury. The skin becomes fibrotic. Cancer-related lymphedema, mostly due to cancer treatments, surgery, radiation, and then affects the lymph system. Infected-related lymphedema, this is due to infections like filarias, which is thread-like parasistic roundworms. This is transmitted by a mosquito bite. This is quite dangerous, and it can cause severe itching, disfiguring of the skin, and cellulitis can occur as it is an infection which is becoming a breeding ground for bacteria to spread. So what causes lymphedema? This is caused by an impairment to the lymphatic system, which oversees maintaining fluid balance in our body, which helps filter and drain the lymph fluid. When the system is jeopardized, lymph fluid will accumulate. It has to go somewhere. The lymphatic system is not like the heart pumping blood. So lymph nodes is literally right under our skin. It's the white interstitial fluid, and it can get blocked, and that's why we need to manually clean it. So this results in swelling in certain areas. There's several protein-rich fluids in the tissue as they attract water by osmosis. The area that is affected becomes swollen, enlarged, and really very uncomfortable. These swellings decrease oxygenation of the tissue, which then interferes with normal functioning of the system. So common, again, causes, as I mentioned earlier, surgery actually is the number one cause. Well, I can be a pretty much a person who's just gone through a surgery. I'd had a knee replacement done, and obviously there is a lot of lymph fluid accumulating around the knee area, especially behind the popliteal, behind that area in the middle of the leg. So I personally work on my own area to help clean the lymph nodes due to the surgical procedure. And this does take a bit of time because the lymph fluid comes back again. So it's a constant struggle to keep cleaning that fluid. This will certainly disrupt the flow of the lymphatic fluid, which I have obviously observed. And this is commonly also known as secondary lymphedema. Then, of course, you've got radiation therapy. This is another common cause that causes the lymph nodes and the vessels, which then affects the ability to function thoroughly, hence leading to lymphedema. We know cancer is also the presence of cancer cells in the lymphatic system can also obstruct normal lymphatic drainage. Infections, as I mentioned earlier, filarias, any parasistic infections, cellulitis are causes of blockages in the system. Any trauma and injury as well can cause damage to the lymphatic vessels or nodes, which results in lymphedema. This mainly occurs during accidents, surgeries, and other forms of trauma. Obesity is also one of them, which can, with people with excess fat or adipose tissue, which has pressure on the lymph nodes and vessels, that pressure that actually happens from the overweight may also cause lymph problems. Lack of movement, activity, living a sedentary lifestyle, let's say. The leg muscles pump up the lymphatic circulation. Without proper movement, this will affect the system and cause swelling in the legs. Even heart conditions, people with congestive heart failure are prone to this and may develop lymphedema. And this is one of my case studies that I will be discussing with you. The reason for this is that your lymphatic ducts empty back into the heart. And if the heart is not functioning well, this will cause swelling in the legs and, of course, weight gain. Also, vascular conditions. The blood vessels carry almost 90% of fluid throughout the body. And if there is a blockage, that person can develop chronic blood vessel issues, which then cause lymphedema. Kidney disease as well is another cause. This kidney helps to remove extra fluid. It will have trouble removing fluid, and that excess fluid will also cause lymphedema. So the most recommended treatment is decongestive lymphatic therapy. This includes therapies like manual lymphatic drainage, which I'll be discussing today, compression devices, exercise compression bandaging, physiotherapy, and of course, skincare advice, because the skin can get quite itchy, red, and there can be a lot of issues. It is quite an extensive program, which also includes psychological counseling and nutrition advices and more. So normally in traditional, medicine with doctors, surgery will be the only option if non-surgical treatments have not helped. So lymphatic bypass procedure can be done, which involves the connecting and rerouting of the lymph vessels and veins. In this manner, it will avoid obstruction and let the lymph drain in the body venous system. Lymph node transfer is another form, and this depends on the severity of the problem. This is healthy system. Debulking is another form which treats severe. Now, this is quite drastic. Fat and tissue in the affected area, placing a skin graft over it. So this is when the condition is absolutely severe. So what is the alternative treatment that really helps? And I truly believe in this because I've seen a lot of cases where they've gone to doctors and they've tried all these other therapies and it has not helped them, and nobody really wants to wear compression stockings for the rest of their lives. So manual lymphatic drainage is probably the most famous style of therapy developed by Emil and Estrid Voda. It is called the Voda technique, and this is what I do. It helps to clear the lymph system. This helps to circulate lymphatic flow, activate fluid circulation, and stimulate the functioning of the immune system, which works together hand in hand with the lymphatic system, and of course, the parasympathetic nervous system. So how does manual lymphatic drainage help? It helps with the reduction of edema, lymphedema. It detoxifies the body. It regenerates new tissue from burns and scars pre and post surgery. So sometimes when a person is going in for surgery, it is recommended to do manual lymphatic drainage to prepare the body before surgery and then continue with the treatment after surgery. And this is exactly what I did. Reduction in chronic fatigue syndrome and fibromyalgia is another condition that it can help. It has anti-aging effects as well because it really cleans the body. It relieves any chronic pain around the area where there's blockage, alleviation of adipose and cellulite tissue, and much more. It also helps with ear, nose, and throat disorders, so you can work on the area where there is a problem. Neurological, dermatological, and dental issues, and Lyme disease. It has quite a big list here that what manual lymphatic drainage can do. A lot of people don't realize that this simple treatment can actually help. It helps to remove metabolic waste, excess water, toxins, bacteria, large protein molecules, and foreign substances. Of course, it also alleviates pain because when the swelling is reduced, the pain is reduced. It also relaxes the sympathetic nervous system, which helps to relieve stress. It definitely supports the immune system, and it will help the body to heal more quickly from injuries like surgical trauma, chronic conditions, and edema. Who should really be having this treatment is normally post-mastectomy, as I mentioned, post-hysterectomy, knee surgery, varicosities, post-surgical swelling, pre-surgery preparation, as I mentioned earlier, and post. Cosmetic surgery as well, which a lot of people actually are going for nowadays, and post-amputation and post-vein stripping, and of course with lymphedema. In the musculoskeletal system, any forms of strains and sprains, ligament tears, fractures and dislocations, rheumatoid arthritis, tendinitis, whiplash, and neck pain. It is Danzlow syndrome, which is, or the image over here, which I have shown. With neurological conditions for multiple sclerosis, Parkinson's disease, carpal tunnel syndrome, Meniere's disease, and neuralgia, and much more. In the dermatological, it helps with acne, eczema, leg ulcers, burns, and scars. Others, allergies, hay fever, sinusitis, tinnitus, as I mentioned earlier, toxic poisonings, scleroderma, and mold. So this is my first case study that I'm sharing. There was a client age 78, presented with the left lower leg stage 3 lymphedema. When he went to see a doctor for his low blood pressure after suffering from high blood pressure most of his life, that doctor immediately offered him a glass of water with sodium to bring the pressure up. Big mistake. The next day, his left leg was terribly swollen, heavy, and painful. His skin was itchy and had started to discolor to a darkish brownish tint. He had difficulty walking and putting any pressure on his left leg. He had multiple ailments, some being coronary heart disease, which an angioplasty had been done. He is diabetic. He has hypothyroidism and large prostate gland surgery done, and digestive issues. He was on several medications, including a high dose of antibiotics for these symptoms. All this could have triggered an attack to his lymphatic system, resulting in severe lymphedema. Now, it is quite scary when somebody just wakes up the next morning and sees their leg completely swollen. So he was recommended 10 sessions daily of manual lymphatic drainage. Since his issue was of the lower extremities, we concentrated on the lower region to clear the massive buildup. He had pitted lymphedema, discolorization, and the tissues were hard. It requires several sessions to clear and soften the tissue and move the lymph towards the correct pathway. It took an overall of 30 sessions until he was cleared and functioning and able to walk without pain. So it really depends on the severity of the condition of the patient and the person before we decide on how many sessions actually would help. Now, I'm a clinical aromatherapist, so I use essential oils in my treatment. And I'm not sure if you all know about aromatherapy. I'm sure all of you must be knowing. It is the life force of a plant, a medicinal plant or a herbal plant, where we extract essential oils from that. And we use that to actually do blends that will help whatever condition that we're treating. So bearing in mind his age, he's 78 years old, and contraindications, we had to choose safe essential oils to help him with this condition. So I choose cypress, which loosens hardening tissues, is great for water retention and edema. Grapefruit was used to release water from the tissues and great for blood circulation, and it's a good stress buster because he was quite agitated. Roman chamomile is an anti-inflammatory and an analgesic. So is helichrysum. And arnica was also used as an anti-inflammatory because we do not use essential oils directly on the skin. It can burn. So we always have to dilute it in a good cold press base oil. So I chose arnica for this reason. Follow-up treatments, we use things like ylang ylang, which brings the blood pressure down, because remember, he had high blood pressure. Celery seed is another essential oil, which is great for water retention, and it's a lymph stimulator. Lemon is also water retention and immune stimulant. Cape chamomile, which comes from Cape Town in South Africa, is an anti-inflammatory. It's a wonderful essential oil. Juniper berry is a great water retention and lymph stimulator. Carrot seed breaks down lymph nodes and dissolves it. And snowbush cape is an immune stimulant, and parsley was used as well, which is great as a water retention. We also created a blend for him to take home so he could actually continue using it twice a day on the affected area. Remember, it was the lower extremities. So I created a blend of Roman chamomile, helichrysum, ylang ylang, and lemon, and I blended that into arnica macerated base oil. After completing 15 daily sessions with him, there were immense improvement in the lymph and circulatory system. The lymphedema has subsided by 70%, and the pain had long subsided where he could walk a bit more normally. We continued with 3 sessions per week for the other 10 sessions and moved to maintenance of once a week to make sure the lymph fluid does not build up again. By this time, he had also seen the right doctors, mainly a nephrologist, to make sure that the kidney is functioning at par, which was very important. So that was a pretty interesting case study. Then there was another case study of a lady, age 48. She presented with lower leg, again with severe lymphedema. Her skin was discolored and highly itchy. She had been suffering from this condition for months, and even after doing a skin tissue analysis at a hospital, thinking that it was parasites, they could not find anything wrong with her. She was lost and miserable. After examining her and completing a thorough consultation, there was no presenting illness or family history of illness that could have caused this severe lymphedema, so it was not genetics. She did, however, mention that she had put her legs in salt water from a boat in Oman, and after that felt quite itchy. It could have been some bites or fungus. It was uncertain at this stage to get a diagnosis. We did 10 sessions of manual lymphatic drainage with 3-day intervals between sessions as she was busy at work. Treatment time, 1 hour, 30 minutes, as we commenced with full body therapy, which takes longer and is more thorough, as her arms were also quite heavy and blocked with lymph fluid. Essential oils were chosen like coriander, which is another great one, like parsley, that helps with water retention and lymph movement. Lemon, amazing detoxifier. Roman chamomile, again, for anti-inflammatory and analgesic properties. Helichrysum, the same. And celery seed, which is also great for water retention. Again, this was mixed into arnica because arnica is a great anti-inflammatory base oil. We did follow-up treatments with carrot seed, clary sage, which is a sleep inducer. She had issues with sleep and she was not comfortable at night. Cypress, great for blood circulation. Fennel is also an amazing water retention and hormone stimulator because she was having issues with that as well. Canuka is anti-parasitic because I wasn't sure what her condition was, so let's get rid of the parasites as well. Peppermint, and again, another great anti-inflammatory. Tea tree to stimulate the immune system. And yarrow blue, which is an anti-inflammatory and an analgesic. It took 6 months in total to help clear the lymphedema. However, there was still some edema left, which is not that bad. You could see her ankles and legs take shape from what it was before. She had lost 15 kilos in water and weight. She was quite heavy, and that helped a lot. She had started taking charge of her nutrition and exercise regime. Recommendation once a week maintenance was offered, which she did do until she left the country for good. Then the last case study is actually my husband. So he, at that time, was 58 years old. He suddenly woke up one morning with severe pitted lymphedema on his left leg. He was thoroughly surprised to see his legs so swollen overnight and with no clue inside of why it occurred. It was very itchy and darkish red in color. He also had fungus, which is athlete's foot. He was taking medication for blood pressure and cholesterol and was slightly on the heavy side. Other than that, he was in good shape, exercising and eating healthy. He was shocked to see himself in this state and asked for advice, well, over the phone because he was not in the country at that time. I advised him to buy some calamine lotion and Roman chamomile to help with the severe itchiness and to bring the pain down. And then when he comes to see me. Treatment was done 10 sessions daily using manual lymphatic drainage with essential oils to break down the hardened tissue and to get rid of water retention and the pitted lymphedema. Most of the concentration was again given to the lower extremities that was affected badly. He felt a lot of pain when I worked on the left leg, especially when cleansing the lymph nodes. However, after several sessions, the tissue softened and I was able to do a thorough cleansing. So blue chamomile was used for him because it's a really strong anti-inflammatory and he was in a lot of pain. Eucalyptus peppermint also is a puretic and it's really good for itchy conditions. Frankincense to boost his immunity, lemon again as a water retention, parsley again for water retention. And again, I used arnica macerated base oil as an anti-inflammatory. I followed up with celery seed. We did several treatments with geranium, as great water retention and boost immunity, Ravinsara to boost immunity, sweet orange to tackle the lymph flow, yarrow blue as an anti-inflammatory, and spearmint as an anti-inflammatory because he did not like peppermint. It took a total of 3 months, and that's his foot, to clear this condition and bring his body back to equilibrium. The first thing that was addressed was the itchiness, which subsided after 4 sessions. During the sessions, he became quite depressed as well, not knowing why he suddenly presented with this condition. I made him an inhaler with Melissa, Neroli, and Rose. This really helps to bring, down depression and any negative thoughts that a person has. And this supported him through the journey, and he's totally recovered with no other issues arising. So thank you, everyone. And this is my 3 case studies that I wanted to share with you as I found them quite interesting. If you have any questions, please do ask.